Congressman Payne Jr. is on his way in. He has represented New Jersey's 10th Congressional District since November of 2012. He is the ranking member of the Committee on Homeland Security's Subcommittee on Emergency Preparedness, Response, and Communications, and the House Committee on Transportation and Infrastructure. Congressman Payne Jr., would you like to say a few words?
Good afternoon. How's everyone? Full house here. Let me just welcome you to today's briefing on anxiety, depression, and opioid addiction among men and boys. First, let me thank my co-chair of the Men's Health Caucus, Representative Mark Wayne Mullen, and the Men's Health Network for making today's event possible. So, we're really in the midst of an opioid addiction crisis in this century. More than 42,000 people died from opioid overdose in 2016, according to the Centers for Disease Control. That's triple the number a decade ago. Our distinguished panel of experts is here to discuss the mental health issues such as anxiety and depression that can lead to an opioid addiction and drug use among men and boys. According to the Anxiety and Depression Association of America, generalized anxiety disorder affects 6.8 million people, adults in the United States. Major depressive disorder is the leading cause of disability in the United States for ages 15 to 44, and that affects another 16.1 million people. Nearly one half of people diagnosed with depression also are diagnosed with anxiety. They kind of go hand in hand. For men and boys, there is another factor that significantly harms their mental health and social stigmas. Studies have shown that there is an underreporting of male mental health issues because society pressures men to be strong and to push through the pain. Too many of our men and boys are suffering in silence because they're embarrassed or because they fear that seeking mental health treatment will make them look weak. Let's finally end this stigma. Today is an important step in the right direction. Our panel is comprised of distinguished experts across the field of mental health and addiction. Joining us today are Eric Murphy, the Program Chief of Depression and Suicide-Related Behavior Program at the National Institute of Mental Health. Wizdom Powell, Director of Health Disparities Institute at the University of Connecticut. Dr. Gregory, a specialist in child and adolescent psychiatry from Columbia University Medical Center. And Nathaniel, Senior Policy Director of Mental Health America, and Fadich, Vice President of the Men's Health Network. I look forward to hearing from today's experts on how we can develop solutions to combat these mental health issues and the drug abuse in the United States. I also look forward to discussing ways Congress can assist in the care providers during these trying times. And, it's unfortunate that we find ourselves with this crisis in the United States. it is something that in the African American community, we have been trying to sound the alarm for 2 to 3 decades. But unfortunately now, the majority population finds itself in this circumstance as well. And so now maybe we can come together as a nation and try to tackle this dreaded issue. So thank you all for being here and weighing in on this very important subject. Thank you. Thank you.